I'm a clinician, okay? I don't like administrative work.
Okay.
So I qualified in India, came to UK in 1983. I had to pass exams to start working. I got my license and I started working. And when you start working, you start
So as a doctor.
as a doctor in 1983. You work as a junior doctor where there is somebody else supervising me. In 6 months, I was so competent, they made me the senior doctor.
Okay.
So my job was to supervise junior doctors because they admit patients, take care of. So my job was to go and snoop around, see where they've gone wrong, correct it, repair it, do all these mistakes, correct it. I continuously did that for about 3-4 years, and I was trying to pass an exam. My mission to come to England was very clear, because in India people travel 8-10 miles, sometimes 100 miles to come and see a doctor, when they shouldn't have come to see a doctor, because there is absolutely nothing wrong. When they come all the way, we have no choice but to do tests and things like that to make them happy. But they have spent a lot of money. I felt uncomfortable. I said, this is ridiculous. You don't need to do all the tests. But I can't make the decision because the hospital fellows make money. So I got fed up and I said, I must find a solution for this, where people could be able to find out whether they need a doctor or don't need a doctor. If they really need a doctor, they can come to the hospital. If they don't need to, I should give them the advice. So just simple, straightforward. There is a serious problem, so that's mine. When I came to England, I developed in 1984, I started writing programs in basics, BBC programs. So in BBC, first I wrote a total parental nutrition. In other words, I had small babies on the machines. I worked in intensive care and neonates. That time it was just the beginning. Okay. Now people talk, but we were starting to learn how to ventilate a baby. So I had problem with mathematics. I couldn't calculate because I had to give not mu milligrams per hour for that baby. So in other words, I have to tell the nurse how much to put it in the bag so that the baby gets that much. It's complicated calculations. So I used sharp computer and wrote a program where I put the weight of the baby and then I put sodium, calcium, potassium, and what is the value, and it minuses everything and does the multiple calculations, and it tells me how much to put in each bag. So I just tell the nurse, put 10 mils of, not even milligrams because the reader won't understand. So mils of calcium into that, 20 mils of sodium into that. So they were doing it and it was fast. Hewlett-Packard got off the idea. They took that idea and made billions out of it because they produced the program in a sophisticated way. Somebody went and told them. So I've been an innovator right from the beginning. And then as soon as that, but the other thing I wanted to do was I had junior doctors who were not competent. They would call me to see everybody. So if I have to be in neonatal unit, A&E, ward and some other place, so I have to prioritize because I'm the only doctor in the whole hospital who has experience. The consultants and professors sitting at home are playing golf. I'm the one who is there, okay? That is the truth.
I know this story.
So I gave them little cards. So if you have this symptom, call me. If you have this symptom, don't call me. If you have this, you do this. Then I wrote a program in Psion. Psion is the first PDA, it's called Personal Digital Assistant. In Psion, I wrote a program called PAT, Pediatric Assessment Tool. And this one, a patient comes in, what is the problem of fever? You touch the fever. What's the age? 3. Oh, what is the problem? Fever. Touch the fever. It says, oh, fever high, mild, moderate. So they had an algorithm. When it says, comes to a stage where I have to see that, it says, call Sri. Oh, Sri, I have this child and the PAT is saying, call you. Oh, good, I'm coming. Because I know that is the one who needs immediate attention. Okay. So I took away this train. But what happened, I wanted to validate that at that time. But I always think backwards and I think God had a reason for me not to validate it. Why? Because at that time, for the first time in 1989, I saw a 14 years old boy who walked in. He had no blood pressure. The doctors couldn't get his blood pressure, nurses couldn't get his blood pressure, A&E doctors couldn't get his blood pressure. They called me at 3 o'clock in the morning. This boy has come in tummy pain. He's talking, he's conscious, but we can't get his blood pressure. That means to say he's dead, really. I had never seen anything like that before. So I rushed to the hospital to see him. I checked the blood pressure and I couldn't get the blood pressure as well.
Okay.
So immediately I said, this is a serious sepsis, because I had so much experience dealing with this in India and all that. So I said, this is a serious sepsis, and I opened his clothes to examine him, and I found a black dot here, like a pimple. Touched that and there is gas underneath.
Okay.
I said, this is crepitus. Everybody looked at me like horror. What is crepitus? No doctor had ever seen that. No nurses had ever heard that, because it is not a common illness. It's a gas gangrene which occurs in India. I've seen a few. So that boy, this is his picture. This is 8 hours later.
Oh, okay.
Okay? Gas spreading here and up. So we couldn't amputate his leg. And this is his X-ray. There, I just took the picture in my room. Can you see the gas there?
Yep.
And this was only here. You can see gas. So he developed what looked like gas gangrene, but that is not a common one. Gas gangrene occurs in tin food. Then I tried to resuscitate him, but within minutes the black spot became bigger and spread up and down.
Okay.
This was a Saturday and I was working in a very small hospital outside. I had to get in touch with Oxford, I had to get in touch with... What do we do? I gave 3 antibiotics, nothing worked. Okay? So I had never seen any child like that. And then he was going downhill, and he was talking to me and he was smelling like horrible, because this is a gas which you can't sit next to him. Parents couldn't sit to him. No mask could help you. Okay? I was sitting with him all the time till he died. But the parents were so annoyed with me because they thought I am a racist who doesn't give antibiotic. So they were physically and verbally abusing me. You Paki bastard, you're not giving, you're a racist, you're not saving my child. You can't, because nobody knew antibiotics. We don't have, okay? So I got really frightened. 2 things. 1, attacked by the patients because they will be upset. And number 2, how am I going to survive? If this infection, I touch it, I get it, what am I going to do? And then the result came up to saying that it is Staphylococcus.
Okay.
Staphylococcus is colonized in every 3rd person in the nose and body. That has become resistant.
So it was one of the MRSA.
MRSA, it is later on called MRSA. This one was in neonates before. We were getting some infections in 1983, 84. But I never seen in bigger people, because all of us are supposed to be immune to it. But this immunity doesn't work anymore. After that, it started going up like this, and it went to the community, it's spreading all over. So I started spending my time observing this. I was single. I didn't have any girlfriends. I had a girlfriend in India, but she was not here. So I had the time to sit and observe. So I was observing what happens, where the nurse is, because if one child is infected, how is the other child gets infected? Are we doing something wrong? So I found 2 to 3 things. One is we put ET tubes to ventilate. Yeah? That one keeps falling out because the babies are moving, children are moving, nurses fiddle around. And number 2, we put catheters for draining urine. And we put IV cannulas to give drips. These 3 are the sources of infection. Okay? I did studies, pilot work, I looked at hand washings, I looked at everything. And I come to know that majority of the infection in the hospital is transferred because of 2 things. 1, nurses and doctors don't take care. Number 2, the chemicals are not working. The antiseptics don't work. Antibiotic is like double barrel gun. Antiseptic is like a matchstick. So matchstick doesn't work. So no matter how much we clean. And the cleaning also the nurses don't know. They just do it like this, put a thing. So they're taking the dirt, they're not moving anything. They're doing all that all the time.
It's not clean. It's just spread it.
It is just to make you feel that they're clean, yeah? And not only that, okay, so I have looked at it under a microscope, every aspect, okay? There are much more than this. So this one has to be, you have to put the chemicals like this, wait for 2 minutes for that chemical to work, and then only put a needle in, right? So I invented a cannula, because when I'm doing, I fail, I have to do another one. I can't wait for 2 minutes. The child is going to be having bananas. Parents are going to beat me up. So I have to quickly do it. I just rub it and put it in. So the more number of attempts I take, the more infection the children get. So I invented a cannula, which is, I got a world patent on it. It's one of the first ones to get, within 6 months I got full patent. Because everybody pushes it like that, I have to pull it back. So in that one I proved that it works, because I did a spring-loaded kind of a thing, demonstrated it on babies. I did a trial, article was published all over the world. Doctors said it's a genius work. Because first time if I get it, lots of problems are solved.
Yeah, of course.
Yeah? But the companies didn't like it because it's a disruptor. B. Brown makes $12 billion every year selling cannulas. Yeah? They didn't want to kill that, because this will de-skill the doctors. They wrote as well, this will de-skill the doctors, we're not going to do it. Fine, I gave up. I just gave up. I said, fuck this. Everybody is going to die. Why should I care? Okay? My wife threw me out of my house. I was on my own again, because she just said, you've gone crazy. Because I said, I'm not interested in becoming a senior doctor, consultant, professor. I'm not interested. I need to find it, because the whole medical profession will be dead if you don't find a solution for this problem. And as I said, it happened. MRSA became VRSA, VRSA started making E. coli. So they are all like buddies. So I have this, you are a tiger, I give it to you. Hey tiger, use my technique. Like that, they have given it. That I wrote about it. If we leave MRSA to multiply, we will have an army of bacteria and viruses and fungus which will simply wipe us out. Yeah? So this, I gave up. Then what happened was, my daughter was born in 2002. I went for this delivery because my wife said, my wife is a pediatrician, she's working here. So I said, I went. So my wife knows me very well, because I'm a very bloody strict bastard in the medical profession, because I don't put up with bullshit. So she said, you're not behaving like a doctor. You're going to just be... I said, okay. Then a friend of mine who's a pediatrician, she came over and she was with me as well. So that maybe something happens. I don't trust anybody else. So as soon as the baby came, I took that, and I always say the first thing every person experiences in life is fear. When they are born, fear when they die. This is the most important, essential emotion which we have to master. So the baby comes in, looks at me in horror, and my mind suddenly works. Oh my God, this baby might fall down tomorrow, get cut and get staphylococcus infection, and probably get the same illness. So I started getting worried that she might get infected and die before I die. So I started work again. I invented another cannula. This was exhibited in Medica. People from all over the world saw it. And it was very well publicized. I've written articles. This was in 2006. And people from... But again, nobody cared. Okay? I sat there, printed 10,000 pamphlets and distributed to everybody, saying, please stop these bacteria. Otherwise, we are fucked. Nobody listened. Then what happens is, I went back to England and I started getting fed up of seeing babies and children die. And I am trying to cover up, telling parents it's got a serious infection. Actually, it isn't. It was given to the child by the nurses and the doctors. I am a Hindu Brahmin priest. I will not lie. Okay? It's my principle. And I cannot conceal the truth either. I can't tell the parents, these hospital fellows are not doing the... It's not... Hospital is colonized. But how you give the bacteria is in our control. But they don't mess around. So I started getting fed up. I left that. And I became a general practitioner, thinking that I'll be a GP because I have foreseen this problem coming. If the bacteria is spreading, what is going to happen? all over the world, people will get infected at home. And if they get it at home, what will happen? They will rush to the hospital. Hospital doesn't have any treatment, so they will die. Yeah. So what can I do to prevent that? So I spent months and days doing all sorts of things and got hold of this PAT, which I had created. There is a method which I had invented, split between common and non-common. So if I implement the same thing and teach people how to differentiate these two, then what will happen? If somebody is infected, I can pick it up in that program and prevent them from coming to see me. Because if they come to see me, they are not only going to infect me, but they're going to infect everybody on the way and the patients waiting in the hospital. It's just common sense. It's nothing high-fluent, right? So I developed a system called Maya, Medical Advice You Access. I named it first Medical Advice You Need. And then my daughter's name is Maya. And it's a coincidence, I don't know what it is. Medical Advice You Access is Maya. So I created a system called Maya. This does two things. One, educate you how to differentiate the two, because we don't diagnose anything based on one symptom. We combine three or four symptoms to say this is a disease. But people don't know that. Artificial intelligence doesn't know that. They only follow one algorithm, right? You go like this, go to Neckarbruck. Then from Neckarbruck, where do you want to go? Stuttgart. You go like this to Stuttgart. From Stuttgart to... Yeah, by the time you do that in artificial intelligence, either you're dead or you're gone mad or you're going to just collapse. Because it is not an easy process. I have seen patients, they come down. As soon as they come down, I have to make sure they're not in pain, they're not having anything serious. Because I worked in intensive care. I have only 20 minutes to diagnose everything. Okay? Exactly, yes. These family doctors don't have that risk. They can wait. I can't wait. I have to. I've done that for 25, 30 years.
Yeah, because the say,
absolutely,
intensive care or
critical care, you have to...
Or the ER guy...
ER is easy because people like me are there on the backside.
Exactly, yes.
Yeah? ER people are different. Whereas a general practitioner doesn't. Yeah, because he has nobody to ask, nobody to supervise. They are independent. But they do whatever they feel like. But they are paid a lot of money, so they're not going to change.
They always have guys like you in the background. If the patient gets worse while he's waiting for the appointment with his GP, he'll rush to the hospital or get rushed to the hospital.
That's not. It was okay, but now it is not okay.
This is easy.
I know, but now it is not going to be okay. Because if he rushes to the hospital, he'll get more infected there. Because 12 bacteria are sitting there waiting for him. Because if you have a virus infection, your immunity dropped, you come to the hospital, we'll give you a fantastic infection which you will die. Yeah, that is for sure, no doubt about it. Yeah. So what I did is, I went to India, sat with the boys and created an app. And the app is called Dr. Maya, where you don't have to answer 101 questions. You have to just choose your symptom, you type in fever, and it will give you drop menus. High fever, mild fever, this fever, that fever, that. Yeah, you choose one. Then you ask another symptom. 3 symptoms you choose, immediately it will tell you, go to the hospital, call 999. Go to chemist, buy paracetamol. Go to ask a nurse. So in other words, I've taken your decision making on what to do, instead of asking your sister, brother, mother, father, go to Google, totally confused, and then you rush to me anyway. I'm paying a lot of money. And when I come there, I look at you, I say, this looks like a smart fellow. Why the hell is he wasting his time coming here? You knew it, but nobody told you. Yeah. So in other words, you have been conditioned that if there is something wrong, go to the doctor. I am trying to uncondition that.
Okay.
How do I do it? My app works very well, no doubt about it. I've updated every time I update. I can sit and update it here. I've created a system where I can. Not only that, if you are a doctor, you can join and create your own system. So that I am saying, you have your system. If you want to see people with high fever, please do see. You just put red color into it. It's all color coded. Okay. You change the yellow color to red color. So the patient who contacts that app will be connected to you. This is systemization.
Which then leads to prioritizing symptoms in the best possible way.
Absolutely. Symptoms are the most important thing in modern medicine. I have written about it in 1996. Article is there. Yeah? Every person comes to with a story of an illness as they have lived and experienced. My duty is to listen and offer a solution, not a prescription. In other words, what I'm saying is I have to listen to your story and tell you what you can do, not what to eat, because no drug will save your life. I've never come across one drug which actually saved any life. Okay, they only suppress the symptoms. So it's a lie. Modern medicine is a lie because it doesn't save any life. I am practically one of the persons who have saved me thousands of lives because I am the one who go in when nobody can resuscitate a dying child or a critically ill child. Tomorrow actually I'm going to London. This is 30 years ago. I helped a child survive and the child is getting married. She's 30 years old. Her father searched for me everywhere because I was known as Dr. Sri. My name is not very well known. I'm not a big professor or anything. Yeah? So nobody can remember Kadiyali of all the things. So they can't find me. But this man spent 6 months doing research to find me and found me. So tomorrow I'm going for her wedding on the 3rd. And she was 30 years. She had pulmonary hemorrhage. Only 3 babies I have seen like that. The blood comes out of the lung and it's like full of blood in the mouth. Okay. So I have put a tube in, but I can't, if it comes out, I can't put another one in. And they'll die. This one was same condition, but somehow I managed because I had developed an ET tube holder. And that ET tube holder allows me to fix it on the tube in such a way it doesn't fall. Yeah. That also is published in medical journal. So I put the tube in, held it firmly so that the tube will not fall out because I didn't want the tube to fall because I can't suck the blood out. I survived. I made her live. And the father and mother, everybody recognized it because I do my job. Okay. After that, I'm not there. I'm not going to be sitting and gabbing with the parents, how I saved your baby's life. Yeah, I'm not. Professors will come, oh, she was very tough, all this drama goes on, which I am not interested. So, nobody identifies me because I just come and go. So, some people did identify me because I used to have a long ponytail. So, everybody said, oh, that Indian doctor with ponytail, he saved my life. But otherwise, nobody knew. And I don't care. So, this app is the simplest one. Here, this starts off when you download it and start it, it goes straight to the symptom. Yeah. Okay. There are, when you register, you can see information. You can see, all these things, write-ups. All the pages are there. Instructions how to use it. All these are there in the thing. But once you register, I'm giving straight away symptoms. Why? Because if you are sick, you don't have the time or patience to go through page after page. Yeah. So symptom here, you just put in fever, right? Fever. Yeah. So it gives you all types of fever, moderate fever, and it says you got pain, sore throat. Yeah. There are about 1,500 symptoms in this sore throat, and I'll put one COVID symptom, loss of taste. Yeah. 3 symptoms. You don't know what color it is. There, it's giving you red. And you can read about it here. And throat, what it is. There are videos, explanation. And these are all, I have found it in various places. I've done that. You connect, it in UK the number is 111. So they will not call emergency 999 for an ambulance. They will speak to the nurse. So because it is 1 blue. But if it is 2 blue, it will say speak to a doctor because nurses can't decide on that. So here when you can see the color coding is there, and in this color coding I have given that 3 red means emergency, go straight to the A&E. 2 red, 1 red you must speak to a doctor. When it comes to blue, I changed it because I don't want them to come and see me because I know they got COVID. I don't want the COVID patient to come and see me. So I'm putting them call to the NHS 111. And they know that there is an infection. So they won't send an ambulance driver without protection. Yeah, it is unethical for us to send you to do the blood test knowingly you can get infected and die. I will not do that because I'm putting your life at risk because I have the knowledge. But unfortunately, the politicians, the government didn't give a shit about it, made people do all this COVID test and gave COVID infection to not only them but spread it around. Because the most important thing they should have not done is to make people go to the test. I met a person here 10 years ago in this American, his name is Andy Garfunkel. He came to give a lecture, I just attended the lecture. Then I met him in the pub and I was talking to him. And I had done all this. I had written this book. This was 2016. I told him about my book and I gave him e-books. I didn't know who he was, somebody, American important politician. Then I got a letter from him, email, asking me, can I write what I explained it to him and give an article? He'll publish it in the journal. And he happens to be the speechwriter for Condoleezza Rice, George Bush, and Colin Powell. And he is the editor of this magazine called American Interest, which is a highly political magazine. I wrote the article in 2016, published in January 2017. The title is very straightforward. It says, Superbug Pandemic and How to Prevent Them. These are MRSA and all the other bacteria. So superbug. Now it is called AMR, antimicrobial resistance. They're simply giving names, but they haven't found a solution. So superbug is the problem. We have 18 superbugs, not one. 12 were colonized in the hospitals and clinics. And they're spreading. So at that time, in that article, I've written everything, including China, in India, how it will be. This is an 8-page article, review article, main one. I also gave a podcast, spoke about it. In America, it was well. Unfortunately, nobody cared. But what happened in England was I raised concern about this. I wrote a letter to Tony Blair in 2017. I sent 100 copies of this to every leader in the world. Every president and every prime minister, including CDC, with the cover letter, the little brochure saying, this is going to happen, please stop it. Right now, you need planning. This was in 2016. They didn't do anything. That's why when COVID came in, nobody had idea what is going to happen. So, but unfortunately, they destroyed humanity by doing that. Because it is the people who have lost their job, it's the businesses who's crumbled, it is the families who have been destroyed. Now they are trying to patch it up with a war, just trying to take it away. It isn't. So what I've done now is, I said, somehow I have to make people understand they should not rush to the hospital. Because no matter what happens in the world, at the end of the day, it is you and your children and your family you have to worry about. Okay? Don't care about what happens in the world. I am going to only worry about my daughter. That's it. You worry about your daughter and children. So I come out with a new idea because I found a new kind of a program which I bought it. This is the app. I've created an app for it. And in this app, what happens is you have to go to the symptom. A little mannequin appears.
Okay.
And this mannequin, now I think...
When someone with no medical knowledge began to lecture on medical topics.
And here it comes in the language of the country. Whatever I'm saying is in English, but here
no medical knowledge and stop searching for information.
it will be in German.
Washing hands,
So if you don't understand what it is, you can see all the things there.
But be smart. Common symptoms are common.
And you can change it to any language.
Managing common illnesses
Now,
depends on the knowledge and experience
So
of the doctor.
here if I change it to English, starts with English. And I can send pictures, I can send videos, I can send, I can put a message service. So the people can send in, type in after that, I have this. So in other words, this is an artificial intelligence based program because I am following the algorithms which is there in my head. How do I diagnose fever? So common symptoms. So what has happened now is everybody has become an expert. Okay? So here,
and stop searching for information.
On average, only 12%
this is the
of patient
latest one,
illnesses
news.
are correctly diagnosed by primary care providers.
This is America.
9 out of 10 are given the wrong diagnosis. Johns Hopkins, and they found medical errors were actually responsible for the death of 251,000 Americans. The third leading cause of death each year. 1 in 3 misdiagnoses lead to serious injury or death, cost the economy
Okay,
billions of
so you
dollars.
can
They're talking
see that
about
later on.
It's
So
probably the
this
most
this
inefficient
one,
industry.
I'm creating making every day. I'm sitting here and making. Today I made one for fever, 3 minutes. So if you go to that app and touch fever, one of this little manicure monkey or pig or something will come up, and he will tell you what is the problem, what you have to do, what you should not do, what is it. Why? Because if you go to a doctor, like it happened here, I was passing too much urine and drinking a lot of water because I live alone, and I was lazy enough not to do exercise or anything, so my blood sugar has gone up. I know pretty well. All I needed is anti-diabetic pills. Yeah, I go to the doctor. The doctor gives me the prescription because I told him I was taking this before. Can you give me, because he gave me metformin without any problem. But he asked me for a blood test. I said, okay. 3 days later, he calls me, panic. Oh, your blood sugar is so high, we need to do more tests. You must come to the clinic right now. I went. He didn't ask me why the blood sugar was high. He took some more blood tests. Then he referred me to the dietitian. I went to the dietitian a month later. And the dietitian looked at the blood sugar. You must go on insulin. And then I got really pissed off. I said, what kind of doctors are these? Nobody has asked me why the blood sugar is so high. It is one blood test, okay? Because 11 o'clock was the appointment. I was drinking a lot of Coca-Cola. My daughter came in the morning to take me, and she and me, we both drank 1 pint of Coca-Cola, which is high sugar, okay? Yeah. Don't you think these people should have asked that? If I didn't know what I was doing, this doctor was convincing that I should take insulin. I kept quiet, wanted to see how he is going to do it. Then I told him, excuse me, do you know what I did in the last 30, 40 years? So I said, I used to teach medicine for people like you. Probably you were never even born when I started teaching, because he looks young, right? I taught medicine for almost 40 years. So he didn't know what to do. I said, just let's try something else. Then he gave me another tablet. But that is, if I didn't know, I would be petrified, and I will be taking insulin every day thinking I'm diabetic, right? How many people are there doing that? They must be doing it to practically everybody. They cover themselves up. Do you know why? Because this GP told me, oh, I have to refer you because the insurance company doesn't pay me. He's only interested in the insurance company money. So you go to that fellow also can't. Because, oh, if he's diabetic, I get more money. Because I became a patient, chronic patient, so he gets more money. That's all he's interested in. He's not interested in my welfare. So my app will undo that. That's why doctors don't like it. General Medical Council doesn't like it. WHO doesn't like it. Nobody likes me. But I am not going to give up. I'm going to do everything. I have done everything possible. I'm doing Facebook marketing right now. I'm learning it myself. I am getting sick and tired. I need help. Absolutely. I don't know, man. I've got everything here. See, this is my book.
I know.
If you have my book, there's a symptom there. Asthma, cough. What is it? Just one paragraph.